Senator Lincoln, I appreciate you taking the time to meet with me today. Just want to talk to you a little bit about the health care reform we're looking at. And just to start us off, just kind of introduce us to where the Senate is right now and where you are personally on
Right.
health care reform.
Well, first of all, the only health care bills that have actually been moving forward, one in the House bill, which passed the House Energy and Commerce Committee, and then there's another bill in the Senate that came out of the Senate Health Committee, the Health, Education, and Labor Committee. And so those bills have been completed by the committee process. I sit on the Senate Finance Committee.
Sure.
And what we're doing in our committee is a little different because although those two committees have worked hard on some policy issues, our committee is responsible for not just the policy but paying for it,
right,
because we are the Finance Committee. And so we've been very conscientious because we definitely want to, many of us on the Senate Finance Committee are very fiscally responsible. We come from rural states. We know how important it is to be fiscally responsible. So we committed ourselves to making sure that the bill we produce is going to be paid for.
Okay.
And so that's critical. So we've been working over the last 20 months, basically. We've had hearings, bipartisan hearings. We've had bipartisan summits. We've done tremendous jobs in trying to include folks like our providers, our doctors, our hospitals, our nurses, also advocacy groups like the AARP, children's advocacy groups. We've included a whole host of different people to come into this conversation, the insurance industry, the pharmaceutical industry, to kind of talk about how do we do this and make sure that, one, we create greater efficiencies in our system. We have the greatest providers. We have the greatest doctors and nurses and hospitals and technology in the world. Our problem is we're not spending our dollars wisely enough because of inefficiencies in our delivery system. Okay. And so our objective there is to create greater efficiency in the delivery system in order to get a bigger bang for our healthcare bucks, because we're spending $1 out of every $6 in this country is spent on healthcare costs.
Well, one of the things you've said is that you want the legislation to be what's called deficit neutral.
Right.
How are you going to do that? How do you make it deficit neutral?
Well, this is a twofer, because one of the most important things we do is to create the changes that will create a bend in the out years, or the cost curve in the out years. And the way that we do that is by creating greater efficiencies in the system. Right now, we don't have the most efficient system. And so when we say budget neutral or deficit neutral, we're making sure that those $700 billion worth of inefficiencies that CBO has scored and said that roughly you can find about $700 billion of savings in inefficiencies, probably anywhere from $14 to $20 billion worth of savings in terms of fraud and abuse. But looking for those places where we not only create savings that we can reinvest into healthcare delivery, but we also do it in a way that in the out years we've created systemic change in the inefficiencies so that we won't be doing this again. In 1997, when the Balanced Budget Act was passed, a lot of that balanced budget was done by just simple cuts to providers. Well, every year we put a Band-Aid on those cuts, and we don't actually see those cuts happen. So we never changed the systemic problems in the delivery system. All we did was cut providers. And so now we're just in just as bad a boat as we were back then. Well, we don't want that to continue. We want to make the systemic changes. Some of those are making sure that we change our system, which now is designed for volume. It's basically a fee-for-service system, and it pays providers, doctors, nurses, hospitals, nursing homes, and others for volume. What we want to do is shift it so that it is targeted for both quality and outcome in value. We want to move from volume to value, because in value you have better outcomes for individuals in terms of their health care, but you lower the cost. Because if you incentivize value and all of a sudden coming out of a hospital, you're less likely to return to the hospital. Hospitals can make investments, providers, all kinds of providers can make investments in how they work hard to create better outcomes so that you're less likely to return. And so that's really important, is to try to change how we see our healthcare. Move it from an acute care system focused only on providing reimbursement for when you get the sickest, to shifting those reimbursements towards wellness and prevention and value-based in terms of outcomes.
Sure. I know one of the things that's been talked a lot in the news recently about is the town hall meetings.
Yeah.
I noticed you have a packed schedule for the next few weeks, but I noticed there was no open forum during that time. Do you plan on having any town hall meetings while you're at home?
Well, one of the things we did was we held town hall meetings all across the state back in April during the Easter break, but also in July during the 4th of July break, with the anticipation that we would, at this juncture, be writing the bill and wanting to have heard. We sent out emails and all kinds of postcards and everything. We also traditionally don't have regular town hall meetings in August because in the past we have found that it's hard to get people to come to them. Now, it might be different now because people are all excited. I know, but the problem has always been it's a family time. People are on vacation or they're getting their kids ready to go back to school, and we found traditionally over the past 10 years or so that it was really hard to get people to come to town hall meetings in August, so we didn't prepare for those. We've got many public appearances, and I'm excited about that. I'm going to spend the month of August here in the state, except for a few days that I'm going to spend with my kids and my husband on vacation. I'll be here listening and visiting with people. I'll be out. I ran into folks at the grocery store yesterday. I saw folks at church, visiting with them and talking to them. As I said, there'll be many public venues that I'll be in, places where people have invited me to come and speak and talk, and I look forward to that. And there's no doubt that people need to know that we do need to hear from them. I just hope and pray that people will be constructive about how we do this. This is an issue that affects every one of us as Americans. As I said, we spend $1 in every $6 on health care costs. We've got to pull our economy back together, and other countries across the globe are doing the same. This is one of the places where we can make a tremendous impact in a positive way on our economy and get ourselves into a competitive nature globally that's really going to put us ahead in the 21st century.